My name is Krystle, and I'm a general surgeon. I do robotic surgery from hernias to gallbladders. I also do benign and malignant breast disease and benign and malignant colon disease. I am also a breast cancer survivor, and this is my story. It all began a couple weeks after I got my second COVID vaccine that I noticed an enlarged lymph node in my armpit. And we were seeing that people that had that vaccine were getting enlarged lymph nodes after. And so I was watching it, and being in the medical profession, I used my resources, checked it with an ultrasound, and it just never got better. And so ultimately, after 4 months, I decided to have it biopsied. It came back as breast cancer. So I went through a long workup of MRI and mammogram and multiple biopsies and found 2 little tumors in the breast. And given my premenopausal status, I was signed up for chemotherapy, neoadjuvant in the upfront setting before any surgery. So I went through 20 weeks of that, 12 weeks of one drug and 8 of 2 other ones. And during that time, I attempted to save my hair using the cold cap, and I went through all of that chemotherapy, followed by a lumpectomy and an axillary lymph node dissection, where they removed at least 19 lymph nodes. And then I had radiation for 6 weeks. That finished in December of 2021. About the summer after is when I started to feel that my arm was having some pain in it. Very superficial. When I'd stretch the arm, it would feel sensitive to touch. Like when I was drying off after a shower, the lower forearm felt that way. And then the top of the hand, I thought that's strange. And something I didn't mention is I also had developed cording after surgery and went through physical therapy for that before any of these symptoms occurred. So I was relieved of the cording and then had these symptoms of pain in the arm. And even being a provider in the breast cancer world, operating on breast cancer patients, it did not click to me that lymphedema could start with pain. And being a breast surgeon who does this exact surgery on other people, I knew that I had a risk of lymphedema. I knew that risk was fairly high, but I didn't know every single symptom that you could develop to know that it's starting for you. Once I developed lymphedema and went to physical therapy, I reached out to a couple of my providers who took care of me during my cancer treatment, one of them being a radiation oncologist, and he mentioned Flexitouch to me. He said, "This is a lymphedema pump." He said, "I will put you in touch with the rep, and you should absolutely look into this. It is very helpful, and it's best to get it started as early as possible to prevent furthering of the lymphedema, worsening of the lymphedema." If I were around my colleagues who treat breast cancer patients on the spectrum of operating on them, radiating them, talking to them about their chemotherapy, I would want to tell them that we should be screening this problem sooner. And we should be using the technology that is out there to screen. There's more than just measuring the arm circumference. I would also tell them to talk about it. Just bring it up, even if you aren't comfortable with all of the ways that lymphedema can present itself. At least get the conversation started. We should be talking about it before we're even operating, before we're even radiating, before we're doing anything. We should bring that up and make it known, because that is just not something I was good at right away either.